Hello, everyone. Welcome and thank you for joining us today. All right. As folks continue to make their way in, just a reminder that this will be recorded and posted to our website. So we are just going to begin. So thank you all very, very much. And welcome to our info session for this call for proposals on the implementation and acceleration streams. My name is Corey Forte, Director of Implementation and Programs, and really excited to share the upcoming call with you all. If you can move the slide forward. A couple of quick notes. We are, of course, trying to be as accessible as possible. You can find the captions in the show caption button at the bottom of your screen. If you have any questions or follow-ups, please don't hesitate to reach out to us if there's any accessibility accommodations that can be made for our future webinars, or if there's opportunities for me to follow up with you afterwards. The video is being recorded and will be posted to our website. This is a Zoom webinar. Please feel free to use the chat function if you have any questions throughout the session. We'll try to answer all of the questions either in the chat directly or at the very end during our Q&A. You can, if needed, request for putting your hand up so that you can ask a question and we can unmute your mic as needed. But where possible, we prefer the chat function for the questions. And a little note about the translation. I'll do my best in French here for everybody. Mais le RSCE s'engage à ce que les projets puissent être soumis et évalués dans les deux langues officielles et la langue de leur choix. Nous savons qu'il existe partout au Canada des projets remarquables prêts à être mis en œuvre et nous sommes très heureux d'offrir l'ensemble de nos activités dans les deux langues officielles. À l'intention de nos partenaires et participantes francophones, bien que cette séance se déroule en anglais, vous pouvez activer les sous-titres en français en suivant les étapes ci-dessus. Affiché sur le sous-titre, simplement cliquez sur l'icône Show Captions dans la barre d'outils des commandes de la réunion. Vous devrez peut-être cliquer sur My Speaking Language pour faire l'apparaître et changer la langue de sous-titres d'anglais à français. Si vous avez toujours des questions, n'hésitez pas de me contacter dans la langue de votre choix. So with that, I hear that some folks might not be able to hear me. Hopefully that has been rectified by those, but thank you so much, and we can move forward one slide. So I do want to make a comment here around land acknowledgement. I myself am very lucky to live, work, and play in what is today called Ottawa, the traditional unceded and unsurrendered Algonquin Anishinaabe territory. I am so thankful for the stewardship since time immemorial of the Algonquin peoples of this land. I also always take these moments, as often many of us do these land acknowledgements, and I do really strongly encourage you to feel free to reflect on the lands on which you are living, working, and playing on today. But I always take these moments to reflect one of the calls from the Truth and Reconciliation Committee's call, which is number 22. Call upon those who can effect change within the Canadian healthcare system to recognize the value of Indigenous healing practices and use them in the treatment of Indigenous patients in collaboration with Indigenous healers and elders where requested by Indigenous patients. The work that we do isn't always strictly in the healthcare systems, but I think we can always do as much as possible to understand the Indigenous context and be receptive to Indigenous patients, elders, and healers, but most importantly, to use our positions to affect change where possible. So I always ask folks to just reflect on not only the lands that they're coming on, but from their ability to influence our pathways along that journey, which is reconciliation. Thanks so much. You can move ahead there. Thanks so much. So again, today you have the opportunity to listen to myself, of course, Jen Zwicker, which is KBHN's chief scientist. Ray Martins has provided us a wonderful video. She's a knowledge broker and family partner. And we're very thankful to have Kelsey Seguin, who's a member of the Child Bright National Youth Advocacy Council. And we appreciate her attendance as well. Today, we'll talk a little bit about us, a little bit about the funding opportunities, as well as some of the detailed application requirements. And then, of course, we'll open up a Q&A session so that we can have a broader conversation with those that are attending. And a reminder that if you aren't able to attend and you're watching this recorded, you can always reach out, and we're very happy to provide you with some more information. Thanks so much. Okay, about KBHN, you can move forward. Uh, all children living with neurodisabilities, 0 to 25, enjoying quality of life inclusion in all aspects of society and reach their full potential. This is our vision, and all the work that we do is really working towards this one goal. I will note again that 0 to 25 is an increase in mandate because we recognize that that transition to adulthood doesn't happen automatically at 18, and we are very happy to support projects that are supporting children all the way up to age 25. Next slide. And we do this through catalyzing collective action across sectors. KBHN ensures optimal care and better outcomes for kids with neurodevelopmental disabilities, and their families. So this is really how we work together, is in partnership with all of you. Looking forward. We have 3 core challenge areas: early and timely identification, effective interventions, and family support. And we're really focused on how we can scale across all of these 3 core challenges to ensure that our families, children, and their caregivers and their families have access to better outcomes across all of these core challenge areas. And we are so thankful for the funding from the Strategic Science Fund through the Innovation, Science and Economic Development Canada, really focusing on increasing the quality of international leading edge research, including that here in Canada, to develop the world-class talent in research and innovation and accelerate the translation of knowledge into action. How can we support real kids? So we're really happy to talk about today's call for proposal, and I believe the next slide might be Jen's.
All right. Thanks, Corey. Hi, everybody. Thanks for being here. I'm going to walk through the 2 funding programs available under this call for proposals, the implementation stream and the acceleration stream. These programs are made possible by Kids Brain Health Network, funded, as Corey said, through the Strategic Science Fund, which is a program of Innovation, Science and Economic Development Canada, and with the support from Brain Canada. Kids Brain Health Network supports impact through these kind of 2 co-produced pathways to impact: implementation and commercialization. There's also the Indigenous Parallel Pathway to Impact, which I'm happy to speak to if questions come up. And that call is going to be coming out in the next kind of weeks or so, weeks to months, I would say. The 2 streams we'll cover today are implementation acceleration and mapping those 2 pathways. So first of all, let's talk about the implementation stream. The implementation stream is designed for projects positioned to bridge the gap between scientific innovation and uptake at a national scale through partnerships. To qualify, projects need to be national in scope, backed by rigorous scientific evidence, and show real potential to increase accessibility of solutions for diverse, vulnerable, or underserved populations. Of course, with a particular focus around children and youth with neurodevelopmental disability or neurodisability. We're looking for proposals that directly address the physical, geographic, or language barriers that currently limit access to early identification, evidence-based interventions, and support for families. So those priority areas that Corey mentioned. Let's go to the next slide. So we welcome applications from academics at a Canadian university or college, research institutes, healthcare organizations, nonprofit organizations, and community groups, cross-sector partnerships and collaboratives. So very open. One requirement applies across the board. Every application and project must include people with lived and living experience as an equal team member, not just as advisors. So we do look for that in applications. Teams also should include people with training in implementation science or hands-on experience implementing solutions in the real world. And I think as we've had a number of these calls out, we see that this is something we're really committed to, because I think it just really means that this is how implementation has to happen, and so we need to make sure there's the right team on board to enable implementation. So that's why we're requiring those roles on the team. Let's go to the next slide. So on the funding side, successful project teams can request up to $200,000 a year for up to 2 years. The funding requires a one-to-one partner match. So for every dollar Kids Brain Health Network provides, your team brings in an equivalent dollar in matched cash or in-kind contributions, and they do need to be from non-federal sources to be considered for that match. So let's go to the next slide. So let's shift to the acceleration stream. This is a bit of a newer stream that we've launched, built for projects positioned to advance Canadian innovation towards broader market readiness and sustainable impact. So it's supporting our commercialization pathway to impact for innovations that already have moved past that early stage research and validation and are ready to move towards commercialization, procurement, licensing, revenue generation, or social enterprise development. Go to the next slide. So we welcome applications from startup ventures or emerging businesses, social enterprises, and mission-driven organizations, not-for-profit organizations, community groups, or entrepreneurs and private sector innovators. So again, very open. Just like implementation, every application must include people with lived and living experience as equal team members. If you're unsure if this stream fits, as a bit of a metric, if your focus is adoption and uptake within, say, health, education, or social service public sector systems, not for sure, but possibly implementation is likely a better fit. If your focus is building a company, filing patents, licensing, scaling towards revenue, acceleration is likely a better fit. But we're always happy to chat with you if you're trying to figure out, the distinctions between the streams. Let's go to the next slide. So the successful acceleration project teams can request up to $100,000 per year for 2 years. Same as the one-to-one matching requirements as in implementation. There's just one slight difference in the sense that at least 25% of that match needs to be in cash, not just in kind. And so with that, I'm going to hand it back to Corey
You
slash
can hand it
Ray.
to me, although I just get the joy of introducing Ray Martin, who's joining us by video. Ray serves a couple of essential roles, which is as a key knowledge broker, especially for those family engagement and research partners. Ray has just a depth of expertise in how to effectively engage families and patients as partners. She provides a service to KBHN interested teams should you like to be linked with potential families, although we recognize that you also may have and hopefully have families that you are already engaging with, where she provides some great reflections on how to deepen that engagement in an authentic way to create the best outcomes. So I'll let my colleague move forward.
Hi, everyone. My name is Ray Martins. I work as a knowledge broker, implementation support specialist, and knowledge mobilization and knowledge translation specialist based between the University of Calgary and McMaster University, where I work with the Family Engagement and Research Training Program. I want to spend the next few minutes talking with you about something that sits at the center of every project funded through the implementation pathway to impact, partnering with people with lived experience. Let's start with why this is important to KBH Plus specifically. KBH sees partnership with people with lived experience as a vital component of any initiative it funds, and that includes this grant call. Every project team applying to the implementation pathway is expected to include people with lived experience as team members and to show how their perspectives will have shaped and will continue to shape the innovation's development, scaling, and evaluation and impact. And that's not a small ask. It means lived experience is built in from the start and it stays present throughout the life of the project. KBH Plus built this expectation into the review criteria because of the strength of partnerships it's a part of the thing that reviewers are actually looking for. And that meaningful engagement of people with lived experience sits right alongside with strength of evidence as well as feasibility as a marker of a strong proposal. So where do I specifically come in? I'm here to support you in the development of your engagement strategy. That might mean helping you to think through who you need at the table and when. It might mean helping you draft a compensation plan. structure an accessible engagement process, or to speak specifically to accessibility in the engagement process, or to find the language to describe your partnership approach clearly in your application. You don't need to have this figured out on your own. Engagement strategy is its own kind of expertise, and it's the expertise that I bring to this work. So think of me as a resource that you can come to as you're building this piece of your proposal, not someone who shows up essentially at the end to review it. So that brings me to the third thing I want to leave you with today. And it's the most important one, to be quite honest. What do we actually mean by partnership in this context? Partnership is a word that can risk being used loosely, so I want to be very precise about it. Authentic partnership with people with lived experience rests in four core principles. The first is shared decision making. People with lived experience share valuable roles over project direction, methodology, and messaging. They're not consulted after the key decisions are already made. They're in the room when those decisions specifically do get made. The second is valuing unique expertise. Lived experience is a distinct and equally valuable form of knowledge alongside academic and clinical training. One doesn't outrank one another. They inform each other specifically. The third is meaningful compensation. When we talk about compensation, we're talking about recognizing lived experience as expertise. While financial compensation is often appropriate, meaningful compensation can also include things like flexible meeting times, accessible formats, transportation or childcare support, food, professional development opportunities, acknowledgement of contributions, and creating an environment where people feel respected and valued. The goal is to remove barriers to participation and ensure that people aren't expected to absorb the costs of improving research. The fourth is active allyship and inclusion. That's on researchers and project teams to address power imbalances directly, to accommodate different accessibility needs, and to intentionally elevate voices that have historically been underrepresented or excluded from this work. These four principles, shared decision-making, valuing unique expertise, meaningful compensation, and active allyship, are what I'll be using as the foundation when I work with you on your engagement strategy. They're also what will help reviewers understand your intentions as you go through your application process. So as you're building your proposal for the implementation pathway to impact, I'd encourage you to reach out to me early on. Let's talk about who your partners are, how decisions will get shared, how you will build a partnership that holds up over the life of the project. So my email is on the slide deck here, and it has been given to Corey as well. Thank you very much for your time, and I look forward to working with many of you. Hi, everyone. My name
Thank you so much, Ray and Abstentia, but we really appreciate Ray's fantastic fantastic video, and we really hope that you all reflect on the ways in which you're engaging lived experience and making sure that you're engaging with lived experience right from the outset to ensure that you have the strongest possible application. Now, very happy to introduce Kelsey to speak about the National Youth Advocacy Council.
Hi, everyone. So my name's Kelsey. Thanks for being here today. So I've been a member of the National Youth Advocacy Council since March 2023. We're now currently in partnership with KBHN, which is fantastic. The Council was founded in 2018, so we advise on funded projects, presentations, other initiatives. We're available to inform research development. Particularly, this is for children with brain-based developmental disabilities, and our council is currently based with 13 youth across 6 provinces in Canada. Next slide, thank you. So our mandate for the National Youth Advocacy Council is that we draw on our own lived experience and knowledge to fulfill our mandate in terms of knowledge mobilization and asking researchers who can ask about their research. They may work with us on their projects, such as asking how to involve youth. Researchers and organization in developing their own council may consult the ENYAC for this as well. I would say personally for me, I've genuinely enjoyed being on this council, as I think our lived experiences should be heard, and it's very important to make sure research is accessible to everyone. And yeah, thank you. And as well, we just released our first podcast for the ENIAC. I will also paste it in the chat. But if you want to listen to our first podcast about research themes, please click this hyperlink below. Thank you.
Thank you so much, Kelsey. I appreciate that so deeply and can't wait to dive into that podcast. I'll pass it over to Jen.
Awesome. Thanks, Kelsey. So let's move to the application process itself, and you're already asking some questions in the chat. So this is going to address things like what needs to be included, the rules around match, funding, and the key dates you'll need to hit. So every application needs to include a written commitment that the funder's investment in the research will be matched from external sources at a ratio of at least 1-to-1, cash or in-kind contributions. So if we go to the next slide, we'll talk a little bit more around this match funding. It has to be an actual contribution, so cash or in kind, and that will be spent on the project. It cannot come from a federal source, so a matched funds used for this competition can't already be reported as matching funds from another federal program, and so you're not kind of doing any sort of double counting. Would emphasize that it's great to have other federal funding, and that can be still described, but it just can't be included as the match, one-to-one match funding. Let's go to the sustainability plan next. So applications will also need to include a detailed plan for sustainability of the initiative beyond the funding term. For the acceleration applicants, this means outlining your commercialization strategy. For implementation applicants, that means outlining your plan for scaling and implementing into practice. So we go to the next slide. The nominated principal investigator or project lead must be eligible to receive operating funds from the Strategic Science Fund. So, just even one of the questions we had, that doesn't necessarily mean you're at a university, but they need to be eligible based on the Strategic Science Fund requirements that we have listed. That said, the project lead or co-project lead can be based at a partner organization. So if you're a startup or an SME, and worried about eligibility, there is some flexibility there. So, definitely reach out if you have any questions and we can help you work through that. Let's go to the next slide. We just wanted to draw your attention that there's a number of templates on the website. So we'd like you to use the templates posted to structure your proposal and supporting materials. So it includes the proposal, the lay abstract or lay summary, the abstract, the project team, CVs, the EDIA statements, impact statements, summary of progress, and references and budget documents. Applications are submitted online through the link on our website. We'll go to the timeline. So we have application submission deadline is November 9th at 6 p.m. Pacific time. The anticipated award start date is April 1st in 2027. And I want to be clear, late applicants really won't be considered because we have kind of tight review timelines that we're working around. So please build in some buffer around the deadline. We'll go to the next slide on the full application. The full application needs to include several pieces. First, a one-page description of your project team, covering your nominated principal investigator, the project lead, any co-principal investigators or co-applicants, collaborators, partners, interest holders. And then you'll have a one-page equity, diversity, inclusivity, and I would also say accessibility statement of underrepresented groups, and a third one-page abstract. Go to the next slide. You also need to include your references, a lay summary of 200 words or less written for a general audience. So really writing it not just for reviewers, but so that it would be understandable to kind of a really lay audience or the general public. A budget justification and budget template, your letters of support that back up your match funding, and any required attachments and CVs for your project PI or project leads, co-PIs, and co-applicants. Okay, let's talk about the proposal. So the core proposal document is has a 10-page limit, and it should cover your project objectives, methods, outcomes, evaluation plan, timelines, and key milestones, and really the role and contribution of each team member and your plan for sustainability beyond a funding term. If you're applying for the acceleration stream, please make sure to include details on your business plan, the go-to-market strategy, or your sustainability pathway. Let's talk a little bit more about the impact statement, which is 2 pages. This is where you can describe metrics that you'll use to assess your project's success. Things like the number of children and families who will benefit, the number and type of knowledge user organizations involved, um, any new policies or practices expected from adopting the innovation, any new intellectual property created, and any new or expanded market for commercialization. So those are just some examples, but certainly looking for, your indication of what you think success might look like based on what you're describing for your proposal. So let's go to the summary of progress. This is a 1-page narrative that's kept separate from your budget. It should cover the principal investigator or project lead's other relevant activities, how this project proposal you're submitting fits within their broader research program or initiatives ongoing, and why this funding is needed now, and how it differs from the other funds you hold or have previously applied for. So we're trying to get this is where you can kind of situate it within the broader landscape of any kind of funding you currently hold. And then let's move to the equity, diversity, and inclusion statement. Kids Brain Health Network funded projects should really aim to increase accessibility of solutions for underserved populations with a special emphasis on underrepresented groups. So this includes Indigenous peoples, racialized individuals, and two-spirit, lesbian, gay, bisexual, transgender, queer, intersex, and other sexually and gender diverse individuals. We're also keen to support projects that address functional needs of youth with neurodisability and diversity across a range of diagnoses. So, encourage that it's not necessarily any one particular diagnosis above any other one. Our projects are really highly encouraged to address this. This isn't just a checkbox for us, it's really a genuine priority. And then as a last piece, I just wanted to highlight the program advisory committee that has been doing some fantastic work. We're very appreciative for all their time and expertise that goes into revising and advising on the various calls that Kids Brain Health Network and KBH Plus have launched, but also reviewing a lot of the applications and giving advice on the ones we can support with kind of limited resources and funding, because we do get a number of really excellent proposals submitted, and these are always really tough conversations. And so just wanted to really acknowledge the incredible group and faces on this slide here, and very grateful for all the time and expertise they have lent to the review process. So with that, I will hand it back to Corey for any questions.
Thank you so much, Jen. I think this was fantastic. And again, just also want to echo your shout out to the incredible folks and advisors that makes this possible for KBH. We have, of course, a very wonderful merit review process and are very eager for a number of great high quality proposals to be submitted again. So really excited for the submission process. Really excited to hear any questions. I've answered a few in the chat, but if anybody has any additional questions, we'll linger for a little while longer. Feel free to put those into the chat. We'd love to answer questions. We're also available should you like to have any other questions in the conversation. Does the matching fund being in kind or cash have any weight on the judging criteria? No, there's no judging weight put on the cash or in-kind match. Where you'll find the judging weight, you'll note, is on the strength of partnerships, of course, and the team. So I would reflect more on that rather than the cash and or in-kind, with the one caveat that for the acceleration stream, you do need 25% as cash match at a minimum. Any other questions? Again, all of the templates are online on the website, so we encourage you to review those in depth, and we are available for questions as they may come up. Very eager to have a number of strong applications as we recognize that this is just a really great call to try to advance our teams along those implementation pathways and for the first time along our commercialization pathway through the acceleration stream. So very eager for lots of strong submissions that we know are going to be coming from this community. We'll give it 2 more minutes for any last minute flurry of typing that may come through. But if not, if we've been really successful at answering all of your questions, I want to say a big thank you to the speakers today for sharing those key perspectives. Kelsey, did you?
There's 2 questions in the Q&A box. I don't know if you see those.
Oh, good. Look at that. Thank you, Kelsey,
Yeah, I
for
was gonna
keeping me.
say.
I was just looking at the chat and not this
So
great
they're not
Q&A
missed. I
function.
just saw it pop up, so.
Well, and this is why it takes a team, so I really appreciate that. So the first question, regarding the budget, does this project require a percentage of project-wide partner cash support or project-wide partner in-kind support? Is there a specific ratio for that? So again, there's no specific ratio for the implementation stream. The implementation stream can be entirely in-kind funding. The ratio for the acceleration stream is that there's a minimum 25% cash match, although it can be more than that. And of course, you can match more than just one-to-one as well. For the one-to-one matching fund requirement, what types of contributions are strictly accepted? Specifically, what percentage must be cash versus in-kind, and do existing operational or R&D expenditures count towards the match? So I've already answered about the ratio piece. I will say in the program guide, which is linked on the website, and I've added it in the chat function, you'll be able to identify the eligible matched criteria. And further, it creates some templates based on how to assess the value of that matched criteria. For instance, people's in-kind time, for instance, needs to be calculated at a certain threshold. I can't just say a consultant costs $8,000 an hour as an example, and that is identified and listed in the Strategic Science Fund program eligibility near the end. The importance around the operational and R&D expenditures, I would say, and we can have a conversation about this offline, is that it needs to be explicitly directed towards the specific project activities. So it can't be necessarily ongoing operational funding, and KBH funds don't contribute towards overhead or administrative costs or operational funding, but rather really around scaling of very specific project-related deliverables and activities. Hopefully that helps, but again, we're accessible for conversations afterwards. Given that our project sits right on the border, what is the exact threshold KBHN uses to distinguish an acceleration project from an implementation project? For instance, does early stage revenue generation tilt us more favorably towards acceleration? I've answered a lot of these. Maybe I'll ask Jen if she wants to weigh in on this one first, or if you'd like me.
Sure. Yeah, sure. So I think, I think it may be helpful if you're not sure to reach out and kind of give us more specifics, and we can kind of help give you a suggestion of what might be helpful to apply to. But I would say like what's said here on early stage revenue generation would likely tilt you more towards acceleration is sort of the stream. Like we're looking at projects that are probably on the implementation side not having a commercialization pathway versus the acceleration having more of a commercialization pathway. So from your response, my first indication would be like it might be more on the acceleration side, but we're always happy to chat offline if you want to talk through it a little bit more. But Corey, maybe you have another thought.
No, I think that's well said. Is we've really given thought to these ideas of pathways to impact being both through implementation, which often looks like engaging with our publicly funded systems, and commercialization, which often looks like navigating sustainability through commercial pathways. And so I would say Jen's comments resonate with myself, but again, always happy to have deeper conversations, and that's why we're here. Moving along, KBHN strongly emphasizes co-production and lived experience. Beyond having individuals with lived experience on the team, what level of formal integration or compensation model does the review panel expect to see documented in the application? Great question. Really appreciate that question. I'll let Jen make some comments, but I will flag in our budget template, we do have a space for the compensation line for lived experience, where you'll note that we link out to the fantastic Child Bright compensation guidelines as a suggested compensation model to follow. So within kind of, it's hidden within templates there, but that is a great compensation tool to reference when you're thinking about that piece. Do you want to add anything, Jen? Yeah, so again, that type of activity is strongly encouraged. The definition of in-kind contributions and what qualifies and what doesn't. Again, I'll direct you to the program guide. It does a fairly extensive identification of those different pieces, but an in-kind example would be a partner provides amplification through their social channels and perhaps activities from a communications manager on another partner team to support some of the delivery, although there might be more nuances there. Jen?
Yeah, or like what often happens is it might be someone's time, like in kind from the partner organization, kind of just describing their in kind time. That's kind of a really common example. But like you said, it needs to be backed by a letter kind of confirming that contribution.
Thank you, Sarah, so much. What are the primary KPIs or metrics that reviewers will use to evaluate success at the end of a 2-year acceleration funding cycle? Is it heavily weighted towards commercial traction revenue or scaling metrics? That's a great question. Of course, our review criteria is publicly posted. Our KPI criteria isn't necessarily publicly posted, although I'll have to think about that. But through our annual impact reports, you'll find common language that we use to celebrate some of this work. I would say that it is heavily weighted towards scaling metrics is probably the truth. We don't evaluate the program's success necessarily based on revenue, although that is of course a consideration around success. So I can't answer that in detail right now, but I will say that we do work very collaboratively with our recipient programs to ensure that they are clearly understanding the KPIs, that we are hoping that they will support their scale through, and recognize that different teams across the acceleration and implementation pathways might have different KPIs that they are developing or leaning into more. I don't know, Jen, if you'd like to answer any piece about that. Is that okay?
No, I think that was good. Yeah.
Does KBHN claim any ownership or equity stake in the intellectual property developed or accelerated through this program? And are there specific commercialization frameworks or Canadian market requirement we need to adhere to? So you will see in the website's call a preferred partnership status clause, which is posted, which does not take any ownership or equity stake, but identifies that KBHN would be a preferred partner should further commercialization activities continue based on the investment in the acceleration piece. So this is something that works across the acceleration and implementation pathways. And really, this is our commitment to continue being partners and potentially exploring what future investments may be possible. So we don't take any ownership, although we do request that preferred partnership status, which is posted on the website. Regarding market requirements, of course, we would expect that all of these are evidence-based, and that if there were needs to be any regulated device, that it, of course, has met those regulated thresholds, etc. But I don't have any further pieces to speak about on that one. I'm keeping reading these through, although I'm noting the that the chat is also filling up, but keeping my focus on the Q&A. So encouraging folks to put pieces in the Q&A as needed. If our behavioral intervention is fully developed and published, but the grant amount is capped at $200,000 per year, does KBHN expect this funding to cover a full clinical trial, or is it intended to co-fund a specific trial phase alongside our matching partners? It's a tough question to answer. I don't know, Jen, if you want to take a stab at it or if you'd like me to.
I mean, I think in short that like as the question's insinuating, 200,000 is not going to cover a clinical trial. That's just never going to happen. That would my suspicion. Nor is it the intent of our application to fund a clinical trial with an implementation project. So, I think it's trying to recognize like the intent of the application is really geared around like the implementation pathway and the scale of a intervention. So, like is said in the response, it might be co-funding to kind of describe some of the implementation components of that trial that you might be working on or something like that. So maybe a hybrid design or something that could be well developed to kind of meet the needs of the trial. But as always, like in a specific situation, like feel free to reach out if you want to talk through any questions you have.
Thanks, Jen. Can the costs borne by clinical hospital partners, such as clinician time or clinical space used for the trial, count directly towards one-to-one non-federal matching requirement? Absolutely, so long as the clinical trial, again, is not federal in design in terms of the the clinician's time, but most often that is absolutely no issue around counting towards the one-to-one match. Our team and core clinical trial sites are in Canada, but we also plan to collaborate with international partners or include international data and sites. Can KBHN grant funds or matching funds be allocated towards trial activities outside of Canada, or must expenditures be strictly restricted to Canadian sites? So all expenses must be expended in Canada. We can count international collaborators towards the one-to-one matching, and they can be members of the team. However, all funding from these two competitions, both the implementation and acceleration, those funds must remain in Canada. If our behavioral intervention is deployed internationally as part of a broader scaling strategy, what percentage of impact or participant base must be demonstrably Canadian to remain compliant with KBHN's mandate? Some great questions here. I appreciate them all. I would say, again, there's the structural piece around our funding must remain in Canada for this call. However, there are encouraged, wherever possible, of course, to think about those international partners. And so we can think broadly around how to navigate those different pieces. So this is more around the funding must remain in Canada. But Jen, if you have any further thoughts, please let me know.
Well, I think I'd just say, there's no limit on impact or partnerships being having to remain in Canada. So if that's happening, that's celebrated, and I think that shouldn't be an issue. But like Corey said, there's just requirements around the funding and where it's spent.
Thanks so much. Is there a bigger weight for companies and projects where it is lived experience owned and led more than supporting and participating? Looking to understand if there is a real importance for the lived experience being core to the design and building of the projects. I always think my statement on this, and Jen, please feel free to follow up after, is that it's a strength having lived experience being the lead or the founder or the PI on any of these projects. However, we do ask that there is an identified lived experience partner whose role is to be the lived experience partner, recognizing that the lead often has to wear many hats. And one of the most important hats of the lived experience partner is to act as that challenge function sometimes through design. So I do think that it is a strength, of course, but we do also ask that lived experience individual is a unique member of the team and not integrated as also the lead of the team. So Jen, if you have any additional thoughts.
Yeah, and I think that's totally true. And I would just say two other things. One, to directly answer it, I don't think there's any particular weighting across either of the scenarios described. Rather, it's really dependent on the proposal and how it comes across as like being clear that there's that lived experience kind of guiding the full development of the project and making sure there's a role, like Corey said, that challenge function and kind of ensuring it remains at the forefront throughout. I would just highlight that our programs advisory committee is a little bit less typical to say a tri-council grant competition where we have a range of experience across the committee as well. So, this is a group that really does value the lived experience and kind of will assess, like, there is no one right way. I think it depends on the application and kind of what makes sense based on what you're proposing and the structure of your team and everything like that. So hopefully that answers that.
These are great questions and makes me really excited for the caliber of applications that we're sure to get. So thank you very, very much. And thank you very much, Jonathan, for your comment. Appreciate that. Yeah, we recognize, of course, the really, the importance of having lived experience throughout the process. And we also recognize that in our merit-based programs that we have a number of review criteria. So we do, as I said, I think it is a strong strength to have lived experience as the lead within the project, and we recognize the importance of having lived experience embedded in other roles throughout the project team. We do, so the next question, do we require each member to submit a CV? The CV template is more the CIHR tri-agency CV. Is this intended for academic applicants only, or can all applicants use it? This is a great question. We do ask for every member to have a CV. We do strongly encourage narrative CV where possible, and we recognize that everybody might have different lived experience folks with different CVs, and we are happy to accept CVs in the format that makes the most sense for the applicant. But I don't know, Jen, if you have thoughts on the CV template. We tend to encourage the narrative CV, I believe, whenever possible.
Yeah, that's the CV we were encouraging folks towards. We recognize that with lots of different people on the team, sometimes CVs can be like a barrier to including people. So, we're not saying it must be in that format, but kind of really encouraging to give a specific format. And the reason for that is I think we're less interested in a laundry list of publications and more about the context around like how that CV and that individual is going to contribute to the project as described. So the more you can tailor people's CVs to that to the proposal with in that kind of narrative template, the stronger it is. So that's what we're going for there. And just to draw back to Jonathan's point, I mean, I think just want to emphasize that I think it's not I think we are really prioritizing lived experience in the design and development, and sometimes that may or may not be the principal investigator, but they may have a team around them. So I'm just trying to, I think we also are trying to just recognize because we're addressing kind of a very large range of organizations and partners. I think it's just when the terms are prioritizing one over the other, I think that's a tough like binary to be describing. But I think we're absolutely emphasizing the importance of lived experience as a key evaluation criteria for the proposals.
Thanks, Jen. Regarding the budget, does this project require a percentage of project-wide partner cash support versus in-kind support? And is there a specific ratio? For the implementation project, there is no ratio. The requires at least a 1-to-1 match for the full request from KBH. However, for the acceleration stream, we do require at least 25% cash match at minimum. The proposal says to describe the role and contribution of each project team member, but another document requires identifying and listing team members. These two seem to repeat each other. Do you have any expectations for these two documents? Maybe I can pass this one to Jen.
Yeah, so sorry, I'm just reading the question again. So the question is asking why we would address the description of the team in the proposal and in the separate document. I think that's what it's getting at. Yeah, so I think we're recognizing that, in the 10 pages, sometimes it's hard to address all the pieces. So we're giving you kind of an extra section to specifically talk about the team contribution. So that's a really great place to do that, to really go into detail on the role and contribution, because we think that is a really important part of success in the project. It would be encouraged to kind of link back to like how that fits into the overall proposal, but a lot of the detail would be in the role and contribution of each team member section. Hopefully that makes sense.
Thank you, Jen. Another great question, and one that comes up often. For members with implementation science training or equivalent experience, is there a clear definition of what can count as implementation experience to substitute for having a certification in implementation science? So I will say a couple of things on this note. So the core principle behind this is that KBHN works really collaboratively with teams in a fund and foster environment to ensure that they can further grow and develop and be successful. And as part of that, we provide teams with implementation supports. And so the important piece is having a member of the team identified as able to participate within those implementation supports, and to be able to understand and support and operationalize some of the supports being delivered to them. KBH does have a number of supportive relationships with groups like the Center for Implementation and groups like the ABS4U teams, where you can find formal certifications and implementation trainings. These are strongly encouraged. They are fantastic, although we recognize that there's a number of webinars or other experiential pieces that exist nationally and internationally that can represent some of those implementation training pieces. And so we recognize that there might be a breadth of experience, but the important piece is that they would be able to participate in some of the implementation activities that KBHN supports them with. So Jen, if you have any further.
Yeah, well, just to build on that, like we recognize that like training's not necessarily everything. And so this would be an opportunity if you have an individual on your team who you feel can really fill that implementation expert kind of role on the team, but maybe doesn't have that training per se, it would be a really good idea to describe like how what their experience is in the team and training section, maybe point to some examples of where they've had some of this past experience in implementation science and things like that. So I guess the short answer is it's not a must that they must have any one specific implementation certification, but it's incumbent on the applicants to make that case around their expertise.
Thank you, Jen. This individual checked the templates listed on the website. Are they the most updated versions, or will they be updated later on? They should all be the most updated versions. We absolutely, somebody who's looked into them might notice that they're very similar to the ones from previous years. We have identified in the proposal some changes to ensure that those applying to the acceleration stream have specifics to help them succeed in the application process. However, those templates should all be updated to or will remain unchanged for this call. However, if there's any errors in them, please let me know. But I believe that our templates are all as they will stay. And then, can a new company be part of the Constitution, or must these companies have operated a certain number of years? Startups are absolutely welcome to apply for the funding. Again, just strongly encouraging startups to think about ensuring that the team is in a strong place to succeed with partnerships, et cetera, as needed. But absolutely, a startup can apply for this funding. Sorry, just reading this next one. I will read this one out. Most people with lived experience don't get as many chances to get funding and get recognition, or even get there without help. There are special recognition of people of color, LGBTQA, women, but people with disabilities usually don't have priority or higher weight to their importance to be a successful tool to help ourselves. Most autistic individuals will have a hard time finding proper work, proper opportunity in many cases, and thus very hard to create a venture to help others. That's why seeking to that there be a priority to help companies made by us, for us, led by us, and supported by people who believe in us. So again, and Jen can respond as well, but we absolutely agree around the importance of lived experience. We take that very, very seriously. We make sure that it's committed in so much of what we do, including our own advisory bodies. Our programs advisory committee being 50% made up of people with lived experience. We're really proud of that. Having incredible teams like the National Youth Advocacy Council, ensuring that lived experience is a funded member of the team wherever possible. We really, really do commit to this work, and we do recognize that, of course, there's so much leadership in those with lived experience, and demonstrating those leadership pieces will, I believe, absolutely be a strength in applications. It is critical that we have lived experience on every application. So I really appreciate your continued advocacy because it's really important, full stop. And we take that very, very seriously, and uh, think that it's something that we, will continue our best to ensure that that is part of every conversation that we are in at every point along the way. I don't know if Jen or anybody else would like to make a comment, but
No, I would agree with that, and I think we're all mostly kind of talking about the same thing. I think it's just
yeah,
the challenge over the word prioritizing, and interestingly, like this has come up in some of our advisory meetings on like, do you like that word priority and kind of how to center it, just recognizing that sometimes, there can be um, unintended consequences of kind of putting priorities forward that maybe don't align for everybody applying in the different circumstances. So we're trying to create a create enough openness that the variety of different circumstances among teams kind of make the most sense. But at the core, the intent is prioritizing lived experience as essential to the implementation commercialization, so that ultimately there's the impact of the projects that you're putting forward, and that's where we're really focused on is that.
thanks.
Thanks for all the
And I
questions.
see there's so many great questions, and I will note that we're coming close to time, but I see another one here, which is the reporting requirements required for both streams. The reporting requirements will be annually. There will be reporting requirements as well as multiple checkpoints throughout the year, but not necessarily written checkpoints, just more connection checkpoints. And of course, as part of the end of project at the end of your second year of funding. I think unless Jen has any other comments, but no, the main reporting function will be annually, both quantitative, financial, and a qualitative impact narrative to help understand and celebrate your program success.
Yeah, and we're really committed to being more than just a funder and a network that really is trying to help you address some of those milestones along the way. So that's kind of how we tend to structure things.
So funding is mostly I guess, in this model, cost reimbursement in the sense that we do provide the funding annually at point of funding. And then, of course, we do review milestones and have great ongoing conversations. But those details are more around the conversations that we might have at a contribution agreement time. But yes, it's not currently milestone gated. All right, I think we are coming to the end of our time. Maybe have time for one more question if it comes through. But most importantly, just want to thank you all for taking the time to ask these important questions. They're going to be incredibly valuable, not only to the team's members that signed in today, but to those that I'm sure will be watching this in the weeks to come. We wish you all the most success possible in building the strong applications that we know will put forward to improve outcomes for children, youth, and their families. So thank you all very, very much. And again, never hesitate to reach out. Very happy to have some conversations and support the process for those that need additional supports. So thank you all very kindly. And Jen, I'll leave you with the last word.
No, just a big thank you to everyone. And Kelsey, is there anything you wanted to say before we wrap up?
No, I'm good. Thanks, though.
Awesome. Yeah, thanks. Thanks for being here.
I appreciate it.